Coming up next on Arizona Horizon, an Arizona bill could ban the use of AI to deny health insurance claims. Also tonight, how an arts program is helping build connections for adults with dementia. And Arizona's largest LGBTQ+ street fair is back this weekend, but with a different feel. Those stories and more next on Arizona Horizon.
Arizona Horizon is made possible by contributions from the Friends of Arizona PBS, members of your public television station.
I was doing some shopping and got a pop-up on my laptop. Computer had a virus. So I called the number on the page, and the guy on the phone wants to take control of my screen to sort it out.
Recognize fraud sooner, so your money lives longer.
This is a tech support scam.
Good evening and welcome to Arizona Horizon. I'm Ted Simons. Arizona today joined 22 other states in filing suit against the U.S. Department of Health and Human Services over the agency's decision to end billions of dollars in public health grants. The lawsuit also names HHS Secretary Robert Kennedy Jr. for what is described as a, quote, reckless decision to terminate the grants. Arizona Attorney General Chris Mays said that cutting the grants would mean at least a $239 million loss to the state. Mays and other attorneys general, all Democrats, claim that the cancellations violate the Administrative Procedures Act. They're calling for a temporary restraining order to keep the cuts from happening. This all comes as HHS today began the process of cutting 10,000 employees. The move includes those whose jobs at the CDC and the FDA involve regulating food and drugs, protection against disease, and researching treatments and cures. Employees were notified of their positions being eliminated by an email sent out this morning. Two states holding elections today are getting national attention. Voters in Florida will decide on two special elections to fill House seats in heavily Republican areas. One of those races is being closely watched due to rising poll numbers for Democrats in what should be a safe Republican seat. And in Wisconsin, control of the state Supreme Court will be decided. The candidates include a conservative supported by Elon Musk and groups tied to Musk who've spent tens of millions of dollars on the race. The liberal candidate has made Musk and his spending a main target of her campaign. The races in Wisconsin and Florida are widely considered to be indications on how the country's feeling about President Trump's second term. And one more headline, the U.S. Justice Department will seek the death penalty for the man accused of killing United Healthcare CEO Brian Thompson. Luigi Mangione faces state and federal charges for allegedly shooting Thompson in Midtown Manhattan in December. Of note, Mangione's legal team recently added an attorney experienced in death penalty cases. A new bill to curb AI's role in denying health insurance claims is making its way through the state legislature. The bill calls for medical judgment cases to be reviewed by licensed medical professionals and not a computer algorithm. For more on this, we welcome Dr. Michael Dunn. He's board member of the Arizona Medical Association. Good to have you here. Welcome to Arizona Horizon.
Thanks for having me.
You bet. All right. So what is the relationship between AI and health insurance claims?
Well, increasingly, we're starting to see that insurance companies are using this artificial intelligence to review and in some cases deny healthcare claims and prior authorizations. They mostly deny that they're doing this, but the evidence is starting to be somewhat overwhelming that they are.
Can you spot a denial? Can you spot AI's footprint, so to speak?
Absolutely. Usually because the reasons for the denial are silly and they don't make a whole lot of sense. They don't follow good medical judgment.
Yeah. Can you give an example? Is there?
Well, we had one last week. A patient came in. It was an occupational injury. She was bit by a cat, and she needed to have the wound cleaned out. She needed a tetanus shot. And the insurance company, we, without getting into too much detail with the coding and stuff, but we build an appropriate level of code to get paid for the visit. Well, the insurance company sent back a denial or what we call a down code, and they down coded it 2 levels, which represented probably $100 less in payment for us. And when we read through what their explanation was, it was very clear that it was a human had not reviewed that.
Yeah, was it kind of gobbledygook? I mean, was that kind of?
It wasn't gobbledygook, but it just didn't make sense.
Yeah.
If you understood the case and what had gone on.
Okay, so the bill that we're talking about here, this basically ensures that what claims aren't arbitrarily denied by AI?
That's right. It doesn't prevent the insurance companies from using AI. I mean, AI is great. We use it. It has lots of potential in healthcare. But what it does is it keeps the insurance company from using it exclusively. If they are going to deny a claim or if they are going to prevent a pre-authorization, then it has to be reviewed by a human.
When you mention pre-authorization, what exactly are you talking about?
Well, a lot of more expensive, more entailed medical procedures need to be pre-authorized by the insurance company. Basically, they'll review the claim and say that, yes, this is an appropriate treatment plan for the patient, or no, it's not. But they need to give you a reason. And oftentimes, when AI is involved, the reasons don't make a whole lot of sense.
Yeah, yeah. So the bill, if I'm correct here, no AI for reviewing or denying claims on its own. There's got to be some sort of human hanging around somewhere.
Correct. Yeah, they're perfectly able to use the AI to screen the claims, but somebody has to sign off on it, and someone has to be responsible, preferably somebody that knows what they're talking about.
Yeah, a medical professional. AMA is backing the bill. Is this pretty much unanimous at the AMA?
Yes, I haven't encountered anybody that has opposed this bill. In fact, all of the major healthcare groups in Arizona support it. The Nurses Association, the Hospital Association, a number of them are supporting it.
I saw that where it poses a serious risk to patient safety, at least those who agree with you and are against this idea. How exactly does it pose a serious risk to safety?
Well, as an example, the Kaiser Family Foundation reviewed some claims from 2023. These were Accountable Care Act claims, and the insurance companies are responsible to submit this information to the government. What they found was that 1 in 5 in-network claims was denied, and nearly 2 out of 5 out-of-network claims were denied. And of the 72 million claims that were in-network denied, only 1% of them were appealed, which means that the care wasn't paid for. It also means that any follow-on care most likely was not provided to the patients.
And yet, I know what people that support the idea of using AI in all situations is that it streamlines bureaucracy, it makes decisions faster, it makes decisions cleaner, and in some ways better. Obviously, you don't think it makes the decisions better, but computer algorithms, these pattern-based computer algorithms, is there a place for that in health insurance, or is that simply too individualistic?
No, I think that they can use the algorithms, but keep in mind the algorithms are only as good as the data that's put into them.
And that would be my next question.
Yeah.
If AI uses what's already there, what does that say about what's already there?
Well, it depends on who's programming the AI. So, and again, I believe there's a place for this, and the insurance companies certainly can use AI, and I would expect that they would. But at the end of the day, we need to protect our patients, and we need somebody that's qualified to review them before any health care is denied or before they prevent any prior authorizations.
Can claims that are rejected by AI, can the AI factor be used in protesting these claims?
I have not personally done that, and I appeal most of the claims that are rejected, and
Really?
that's not normal.
Yes.
It's a very expensive, tedious, and time-consuming process to appeal these claims, but generally I appeal them, especially if I think that we're in the right. Generally at a loss. It costs us more to appeal it than any type of money that I would stand to recoup. But in the future, that's possible. If this law were to be passed, and we truly believe that they didn't comply with the law, then absolutely that could be a factor.
Are you finding in this age of AI that you are appealing more?
Yes, we're doing a lot more appealing than we ever have in the past, but we're also getting denied more often.
Yes, and that's thus the bill. Okay, the bill status, unanimous, close to unanimous out of the House, right?
I believe we were unanimous out of the House, and it went through the Finance Committee, and nearly unanimous out of the Finance Committee, and we're hoping that it will sail through the rest of the Senate, and and we'll be able to get it passed and get it on the governor's desk.
Okay, so it's still in the Senate, still waiting to move from there.
Correct.
My last question to you, and you kind of referred to this earlier, but maybe a little bit more here. What is the role of AI in healthcare in general and health insurance in particular?
Well, I believe that there's a lot of the administrative, the more tedious tasks that AI could take on. In fact, it already is. You know, a lot of practices are using AI in the exam room to hear the interaction between the patient and the physician, and creating a very solid note about what that interaction was. And I expect that will only become more prevalent. It will make the provider's time more productive. Well, and even coding and billing. I mean, it's a great check to make sure that did we capture all the codes that we were entitled to capture? Did we code it correctly? Are there subcodes that we should add?
Right.
And AI is very good at that. But it's again, it's only as good as the data and the person programming it. And if there are ulterior motives in the data and the person programming it, it might come out a little bit different.
Dr. Michael Dunn, Arizona Medical Association. Good conversation. Good to have you here.
Thank you. Appreciate it.
Thinking about the future is something we all share. By preparing an estate plan, you're safeguarding more than just matters of finances and inheritance. You're also guiding future health decisions, providing for loved ones, and creating your legacy. Estate plans help you protect the things that matter most. Put your mind at ease by planning your future today.
I really do enjoy volunteering. I like to think that I have made a difference. That's enough. I don't need to be patted on the back. I've included my PBS station in my future plans. It's not a big gift, but something that will help them.
For more information about including Arizona PBS in your future plans, visit azpbs.org/giving.
Every little bit helps. If we can do a whole lot of little bits, then we've done a great service.
The Phoenix Pride Rainbows Festival is set for this weekend in downtown Phoenix. Organizers of Arizona's largest LGBTQ+ community street fair say that the event might have a little bit of a different feel this year due to the current political climate. Joining us now is Jeremy Helfgott of JM Helfgott Communications to talk more about that and the festival. Jeremy, good to see you again.
Thanks for having me back, Ted.
You betcha. Thanks for coming on. For those not sure about what's going on here, the Phoenix Pride Rainbows Festival. What are we talking about?
This is the second largest annual LGBTQ+ community event in Arizona. Free event from 10 a.m. to 6 p.m. this Saturday and Sunday at the Heritage Square Historic District. We're expecting a crowd of more than 20,000 throughout the weekend, a couple of hundred exhibitors, community organizations, food, entertainment, wonderful time, and an opportunity to gather as community in a time that's been incredibly difficult for some in our population.
I want to get to that in a second here, but I think I refer to it as the largest one. The largest one is the one at Steele Indian School Park, correct?
That's correct. That's the Phoenix Pride Festival and Parade weekend, taking place in the fall.
All right, the fall, the spring. I got them mixed up there, but we got them all figured out right now. Heritage Square, downtown Phoenix, is supposed to be a celebration. Does it feel that way?
It certainly will be a celebration of community. This is a chance for people to come together and be in a place that's accepting, that's safe, that's welcoming. And folks in our community are really striving, hungering for that right now. Obviously, the LGBTQ+ community has been under the harshest attack we've seen, maybe in U.S. history in the last 2 months. Attempts to erase history, attempts to erase the transgender population from really legal and noted existence. And we're going to be together reminding everyone in the community that they are not alone, that we are continuing to fight, that we are active, and we're going to be seen this weekend, which is critical.
I think your executive director was quoted as saying our community is being targeted with hateful and harmful policies at a pace and on a scale we haven't seen in decades.
This is the truth. We have seen attempts through executive orders, through unilateral action coming out of the White House, not to mention other attempts at the Arizona legislature, and thankfully here in state, Governor Hobbs is wielding her veto stamp and protecting the community as she has always promised to do. But at the federal level, what we're seeing is at a rate I don't think anyone was expecting.
Celebrating diversity of the LGBTQ plus community is also mentioned as a goal and a design for this event. Celebrating the diversity that is LGBTQ plus or within that community.
Yes and yes, Ted. The LGBTQ plus community is really the epitome of intersectionality because LGBTQ plus individuals exist in all walks of life, every nationality, all throughout geography, socioeconomic status, religion, ethnicity. So we're bringing together people who are under attack because of their personal identity as LGBTQ plus individuals, but in some cases also as members of undocumented immigrant communities or communities of color or religious communities that are being targeted and persecuted. And so we have a lot of people to uplift with what we're doing this weekend.
Why do you think the folks LGBTQ plus, why do you think they're being targeted? What happened here with the last election and now with the Trump administration and those aligned therein? What happened? Why do you think this is happening?
I think this is really a matter of scapegoating that's as old as human history itself. We saw similar moves and sentiments at times, maybe not as extreme, towards the gay and lesbian community. Now the transgender community is under attack. We've had nearly a decade of same-sex marriage. People have accepted that. People have seen that the sky didn't fall. So now they're looking for a new section of the community to target, to other, to try and make different, and to try and blame for problems that have nothing to do with people who are just trying to live their authentic lives and be who they are.
Okay, let's get back to the event here. Family-friendly, pet-friendly, the whole 9 yards?
Family-friendly, pet-friendly. The four-legged family will be out. It is a free event. PhoenixPride.org has all of the information, including the entertainment lineup, what to bring, what not to bring, who's going to be exhibiting, the food options, all of the information at PhoenixPride.org.
And that includes parking information, downtown Heritage Square parking information?
Parking and public transportation information. Fortunately, the D-backs are on the road this weekend, so parking will be somewhat available, but we encourage public transportation as parking is always more scarce than we'd like it to be.
All right, Jeremy Helfgott, always a pleasure to see you. Thank you so much for joining us at Phoenix Pride Rainbows Festival, Heritage Square.
Thanks again, Ted. Always appreciate it.
You bet.
Hi, we're Paper Foxes, and you're listening to Playlist 48 on Arizona PBS.
Seek, destroy, is programmed in me. Say my name, a number again. How do you lie through broken smiles? How do you say these things? Everyone knows we've all gone.
Getting out of my head and constantly having to be present. That's my favorite thing about music, is it forces a presence that like very few actions and things that I do in my life force me to do.
I'm Amna Nawaz. Tonight on the NewsHour, the world braces for another round of tariffs from the Trump administration. That's coming up at 6 on Arizona PBS.
Mesa Arts Center is offering a creative workshop to adults with dementia and their caregivers with the goal of building a sense of community and creativity. And tonight is part of our monthly AARP-sponsored segment that highlights issues important to older adults in Arizona. We learn more about the program called Arts in Mind. And here to help with that is Laura Wild. She's Director of Studios at the Mesa Arts Center. Laura, good to see you again. Thanks for joining us.
Absolutely. Thanks for having us.
All right, Arts in Mind. Give me a definition here.
Arts in Mind is a program we've actually had at Mesa Arts Center for a long time, but we've revamped it, and it's designed to provide caregivers and their loved ones living with dementia an opportunity to do a number of different things. For caregivers, it's to provide them respite and a sense of community, and for loved ones, it's to allow them to experience art making in a safe, supportive environment that's what I call no-fail environment.
Interesting. And I see it starts with 30 minutes of social time. What's that all about?
Yes, absolutely. So after the pandemic, we did a lot of research about what families with loved ones living with dementia were experiencing. And we lost a bit of that community during the pandemic. So when we came back, we decided it was important to have 30 minutes together just to talk and experience. We provide lots of snacks and coffee. And then after that 30 minutes, both groups, the caregivers go into one room right next door, and the loved ones stay in that room for their own project. It provides the loved ones living with dementia an arts experience in a supportive environment with teaching artists and volunteers that have been trained, while the caregivers get a moment to do their own thing and rest and relax a little bit.
Yeah. 60-minute art making session?
That's correct.
And what kind of art is being made? We're seeing some of it there, but what kind of art is being made?
It can be really anything that we like. It's a lot of visual arts, right? The tangible motor skills are really important, but we've also done movement, so things like fibers, we've done music, we've done storytelling, painting and drawing. We like to really mix it up and offer a wide variety for our participants.
It sounds like hands-on is a big deal here, right?
Yes, absolutely. I think tactile motor skills are really wonderful and lovely. It's a little less vulnerable maybe perhaps than the performing arts, right? Getting up and dancing or acting perhaps.
And art, it seems though, and we've talked about this in the past, art engages the brain in different ways and in positive ways. True?
Absolutely, yes. So it does a multitude of different things, right? And the goal is not just to create art. It's to build community, try something new, gain the confidence to do that, and hopefully contribute to overall wellness. So we have measured that after participants have spent an Arts in Mind morning with us, that sometimes that positive mood for the loved one with dementia can last all day. And if you ask a caregiver about how to deal with their loved one or take care of them, that positive mood lasting so long is really significant to them.
I was going to ask what kind of response have you had from the caregivers, not only for the respite, but from what, the folks that they're caring for being involved with creating things.
Yes, absolutely. Just last month we had a caregiver come in, and after about 30 minutes or so, she came back to the room with her loved one, and she was amazed to see that he was totally engaged, that he probably didn't forget about her, but that he was in a space where he was happy with others, he was having a great time, he didn't notice her absence. And I think she was really touched by that, and also just really grateful for that experience, right?
Yes.
We know that adults living with dementia experience a loss of autonomy and a loss of so many different things, right? But it can contribute to a negative mood. So having these moments of positivity and brightness are really significant.
There's I think there's a new book out there that talks about the creative process and the right side of the brain, how if you engage that and keep that going, the left side, the analytical side, the worry side, the anxiety side, doesn't have anywhere to go, and it actually is a way to, for those maybe not with early forms of dementia, but kind of keep some of that worry and that concern at bay. Does that make sense?
Absolutely. I think we definitely see evidence of that. Emotional memory, interestingly, is the type of memory that lasts the longest. And so a lot of times engaging with things like music and art and poetry can kind of elicit some of those deep stored memories. We've had participants just break into song, and then we've had another participant join them. and it's really just a great thing to see.
Okay, now this is open. Is this a free program here?
Yes, we're super lucky that it's completely free thanks to the support of the Blue Cross Blue Shield of Arizona and Gila River Indian community. It's the second Tuesday of every month, and anybody who wants to learn more or sign up just needs to go to mesaartscenter.com/artsandmind.
Okay, and again, Mesa Arts Center, I got to ask you real quickly.
Absolutely.
Mesa Arts Center, downtown Mesa. Holy smokes, what's going on down there?
We're growing every single day. It's an amazing place to be. If you haven't been to Mesa ever before or haven't been in the last even 5 years, I challenge you to come down, light rail or drive, but it's an astounding place. Mesa Arts Center is celebrating 20 years this year, and so you're completely right. Mesa is just an incredible place to be right now.
And with that growth, Mesa Arts Center is hanging in there. It's growing with the growth?
Absolutely, yes. We have a brand new Broadway series. It's only the second year that we've been able to bring Broadway back. We have more classes, more shows, a ton of exhibitions in our museum as well. So we just had our first ever Alt Fest last week, so plenty to see and do at Mesa Arts Center.
All right, one more time, for folks that are interested in this as far as the dementia care and the caregivers, where do they go?
mesaartscenter.com/artsandmind.
So, Arts and Mind. All right, Laura Wild, Mesa Arts Center, again, congratulations on this. It must be rewarding to put something like this together and watch it succeed.
Absolutely, thank you very much.
Good to have you here. And that is it for now. I'm Ted Simons. Thank you so much for joining us. You have a great evening.